Hi everybody, in this video we are going to discuss about the AIDS. Okay, we are going to discuss and continue about the topic called as the AIDS. So we have discussed about different topics regarding how the mode of infection will be taking place regarding the AIDS, and we also seen the last part as the test. Okay, what is the test that is being conducted to confirm the disease called as AIDS. Now in this video we are going to discuss about the treatment and followed by the transmission, and also how it will not spread, and what is the incubation period we are going to see, and continue with prevention of AIDS. Now here, what is the treatment when we identify with the test? Okay, we already said the test that is being conducted is what? ELISA. Okay, we said the test that is being conducted is ELISA, enzyme linked immunosorbent assay, is the test that is conducted whether it will be AIDS or not. Okay, whether it is AIDS, suffering with AIDS or not. And confirmatory test is what? We said it is Western blotting technique. Okay, we said that Western blotting technique is the test that is confirms that he or she is suffering with what? AIDS. Okay, and there is also another test called as what? PCR, polymerase chain reaction. Okay, polymerase chain reaction. These are the different tests that are conducted to identify a particular person is suffering with AIDS now. Now, once it is confirmed that it is AIDS, we have to give some medication. Okay, we have to give some medication. So, is there a medicine? Yes, there is the medicine, but please remember that these two medicines which are used for treating the AIDS, okay, are only to control, okay, the disease, but it will not prevent death. Please remember that. It is very important that this treatment is given to control the disease but cannot prevent the death, which means the person who suffers with AIDS will be dying very soon. Okay, it causes or it leads to early death. It leads to early death. But these two medicines, okay, for treatment, okay, so here there are two medicines or drugs, okay, the drugs that are used to treat the persons who are suffering with AIDS are zidovudine. Okay, zidovudine. This is the first drug. Please remember, which is the first drug means, as it is indicated here. Okay, this is the first drug that is being, okay, brought to use for controlling against the AIDS. Okay, against the AIDS. So zidovudine, otherwise it is called as AZT. Okay, 3' azidose and 3' dideoxythymidine we call it as. Please remember, which will be useful in objective part. Okay, so this is the first medicine, zidovudine. Okay, zidovudine. And the second medicine is diadenosine. Okay, diadenosine. Okay, diadenosine. So here this is also called in short as DDI. Okay, DDI, which means dideoxyinosine. Dideoxyinosine. These are the two drugs, medicines. Okay, otherwise we commonly call them as what? Medicines. These are the two drugs which are used for the disease called as AIDS. But here, please remember that these two medicines or drugs will not cure the disease completely. They can only control the disease called as AIDS. But please remember, once a person is attacked by AIDS, it can lead to death, or compulsorily it will lead to death. But the only thing is, by using these two drugs, we can prolong, okay, we can prolong or extend the life of a person, okay, because they can resist this disease, but they cannot cure from this disease, and compulsorily the person who is suffering with AIDS will be dying. That's what we have to remember regarding the treatment, And now when you see about transmission, now we studied about the mode of infection. We have seen the structure of HIV virus, we have seen the mode of infection, we have seen the symptoms, and we have seen the test, and now we have seen the treatment. Now the question is, how this disease will be spreading? Okay, how this disease is spreading from one person to another person. It's a very important part, okay, because here if you are saying transmission, how it spreads from one person to another person means it is through sexual contact. Okay, it is through the sexual contact with infected person. Okay, sexual contact with infected person. Okay, so if a person is suffering with AIDS, and if there is somebody who is healthy who are participating in sex with that particular person, then there are chances that the healthy person may get this disease from an infected person. So this disease, okay, transmission of AIDS is mainly through what? Sexual contact with infected person. This is about the main reason. 70% of the people are is the main reason how the AIDS is spreading. It is 70% through what? Through the sexual contact only. Please remember, 70% of AIDS is spread or transmission is taking place only through sexual contact. And now this disease is not only through sexual contact. Please remember, okay, we should not get misunderstood or confused when we are seeing a person suffering with AIDS that he or she practiced illegal sex. No. Okay, we should not get confused with that. We should not misunderstand like that. Why? Because this, even though we said that 70% is passed or transmitted through sexual contact, but please remember there are other ways how this disease is spread. Okay, how this disease is spread. It is also spread through transfusion of contaminated, okay, transfusion of contaminated blood and blood products. Okay, transfusion of contaminated blood and blood products, or in simple, when they are transfusing the blood from one person to another person, okay, there are chances that that blood may carry the virus and it may enter into a person who is healthy and who is taking the blood, okay, who is taking the blood. When a person who is donating the blood is suffering with HIV virus, there are chances that the other person who is taking the blood may also suffer with this disease. So that's why we should not conclude that it is only through sexual contact. Or if you are seeing a person who is suffering with AIDS, we should not think that he or she practiced illegal sex. Because what we are saying, it is the transmission of this disease is also taking place through contaminated blood and blood products. Okay, blood and blood products. And not only that, by sharing infected needles, as in the case of intravenous drugs. Okay, as in the case of intravenous drugs. Now you are seeing the youth, okay, especially the youth who will be involved or practicing or getting addicted to the drugs. Drugs means here what? Illegal drugs. Please remember, illegal drugs, because we should not get confused with the drugs which are used as medicine, okay, which are used as medicine. These are illegal drugs, okay, illegal drugs, which we are going to study in later part of this chapter. So these drugs, when the youth are taking, they will be sharing, not only youth, okay, not only youth, many people, especially it is been regarding the youth who are tempted to take these drugs. When they are taking, they may sit and they use the same needle to take the drug into the veins or into the blood vessels. So when they are trying to take this, as we call it as intravenous drugs, okay, they may use the same needles, and because of that there are chances that the healthy person amongst them or the healthy people amongst them may also carry this disease, because there may be one person who is suffering with AIDS in that particular group. So that particular person is using the same needle. So when he is using the same needle, he is sharing that needle with others. So there are chances that like that the disease may spread from one person to another person. And not only this, even if you are seeing from infected mother to her child, okay, if a mother who is conceived, pregnant, okay, after carrying the 9 months, okay, then there are chances that the mother, infected mother, can spread or carry this disease, transmit this disease to her child through what? Through the placenta, which is a connection between the baby child that is growing in the mother's womb and the uterus of the mother. So all the blood, okay, nutrients will be carried through the placenta only. Along with the nutrients, even the antibodies also carried. And there are chances that this HIV virus, can also pass through the placenta from the mother's blood into the child, and child may get infected with this disease. So it should be very careful. Okay, here we should be very careful that the mother should be cross-checked. Okay, mother should be actually cross-checked whether he or whether she is suffering with AIDS or not, because there is possibility of the HIV virus to move or transmit from mother to the child through the placenta. So here And please remember, these are all through what? The fluids, okay, body fluids. Please remember, this HIV virus is passing through the fluids, okay, through the fluids. Like main fluid is what? The blood, okay, main fluid is the blood. And all these people, okay, those people, please remember, those people are, let us come like this, let me say like this, who are at high risk of suffering with AIDS. Who are at high risk of suffering with AIDS. Please remember, those who are at high risk, okay, who are at high risk of suffering with AIDS. Those people who are having multiple sexual partners, okay, multiple sexual partners means those people who practice sex with many people, okay, there are chances that they will be suffering with what? AIDS. So if an individual who is practicing sex with many people, then there are chances of high risk of AIDS, okay. Multiple sexual partners will be having more risk of suffering with AIDS. And at the same time, those people who are at continuously in need of blood transfusion are at high risk of suffering with HIV virus or AIDS, okay, suffering with AIDS. And not only that, those people, okay, who are infected, okay, sharing the infected needles, okay, sharing the infected needles are at high risk of suffering with AIDS. Not only that, even we can say that from mother to the child are also suffering with AIDS now, are also suffering with AIDS. And now, please remember, now the question is that as we see in other diseases where the person who is suffering with a disease will be isolated. Say suppose as we are now seeing COVID, okay, those people who are suffering with COVID should be isolated from the group. But why? It is because it can spread through coughing or sneezing. So, but here, please remember that this disease called as AIDS, okay, will not spread, okay, it do not spread by touch or physical contact, okay, touch or physical contact, which means if I am sitting with a person suffering with AIDS, I will not suffer with AIDS. If it will not spread through physical contact, we are saying, means maybe you are sharing the same mobile, okay, or maybe you are by sharing the towels, okay, it will not spread. By sharing the same swimming pool or toilets, it will not spread, because there are some other diseases which will spread, okay, through physical contact or through the touch. Even when sharing the same utensils will not spread this disease, okay, it will not be responsible for spreading this disease. By kissing them, by embracing them, or by hugging them, this disease will not spread, okay, this disease will not spread. That's what we have to remember when we are talking about how this disease will be spreading, So as soon as this question comes, you should remember that it spreads through the fluids, okay, it spreads through the fluids, and 70% it is through the sexual contact, and followed by the other three, okay, other three. Who are at high risk means those who are practicing multiple sexual partners, and those who require continuous transmission, blood transfusion, okay, blood transfusion, and also by sharing the infected needles, and also infected mother to the child, we said. But it will not spread by what? Touch or physical contact. So we can sit with them, we can talk with them, but it will not be the cause for spreading the disease called as AIDS. And now, it is taking incubation period. Means what? What do you mean by the word incubation period? The time taken from the time taken for that particular microbe to express its signs and symptoms, or to cause the disease. Let us simply say that the time taken for that microorganism to cause the disease, it is called as what? Incubation period. It may be between 5 to 10 years. Nowadays we are saying even it takes few months also, okay. This is regarding with your NCERT textbook. It may be taking 5 to 10 years, okay. It may take 5 to 10 years. Means what? Within these 5 to 10 years, even though that particular person is having this HIV virus in the body, he will not show any signs and symptoms. All these 5 to 10 years, he or she will not show any signs and symptoms. But that particular HIV virus will be present inside the body of that individual. So there are chances thus when it is not identified, now through the blood it may be transfused from one person to another person. When a particular person don't know that he is having the HIV virus, that person don't know the HIV virus is there inside his body and participating in sex, there are chances that it may be spreading to his partner. Okay, and even through the needles, and even when the mother is not identified that she is suffering with the HIV virus or AIDS. Why? Because she cannot be identified, because she is having normal healthy life. Okay, healthy life, because the virus is taking what, 5 to 10 years to be expressed. Okay, so that's why she is very healthy, she feels. And but what happens, this HIV virus will be carried from mother to the baby child that is growing in the womb. So this is how the disease may spread, and it will not spread. We have seen how it will not spread, and we have seen the incubation period. Now we will see prevention of AIDS. Okay, prevention of AIDS. There are many organizations. Okay, there are many organizations which are coming forward to educate the people about AIDS. To educate the people about AIDS and bring awareness. Okay, to bring awareness in the people that how dangerous this disease is and how to protect themselves from this disease. Okay, so in those organizations, the most important organizations are National AIDS Control Organization, National AIDS Control Organization, NACO we are calling it as National AIDS Control Organization, and many non-governmental organizations. Okay, non-governmental organizations, we are calling them as NGOs. Okay, we are calling them as NGOs. These organizations are educating the people about AIDS, bringing awareness about the AIDS, how dangerous this disease is, and how they should protect themselves from this AIDS. Okay, from this disease, from this particular disease, AIDS. Okay, and there are many other programs started by World Health Organization. Okay, started by World Health Organization to bring awareness in the people and protect themselves from this particular disease called as AIDS. Okay, protect them from HIV virus. Now, among those programs started by World Health Organization, okay, they are bringing awareness about making blood safe from HIV. They are ensuring that the blood should be safe from what? HIV. Means what? In the blood banks, okay, in the blood banks, compulsorily they should take the steps to identify that the blood that is being donated will not contain what? The HIV virus. So it should be ensured, okay, ensured that the blood that is taken or collected should be free from what? HIV. So making blood safe from what? HIV, okay, in the blood banks, and use of disposable needles and syringes. Okay, use of disposable needles and syringes, and it is any type of hospital, okay, public or private hospitals, okay, public or private hospitals, they should, it is a must and should that they should use what? Disposable needles and syringes. Okay, disposable needles and syringes. And at the same time, they are also promoting the free distribution of what? Condoms. Okay, free distribution of condoms. Okay, so that the disease will not spread from one person to another person. Okay, one person to another person. Why? Because there may be people who will hide this, that they may not express that they are suffering with what? AIDS. So that's why they are also promoting what? The condoms. Okay, condoms, so that this disease, okay, will not be in direct contact spreading to other person. Okay, directly it will not spread to other person. And there is also controlling of drug abuse. Okay, World Health Organization is also promoting controlling of what? Drug abuse. They are educating the people, counseling the youth not to use what? The drugs. Why? Because apart from the use of drugs, maybe because of stress and all, they will be addicted, but there is also another important disease that may be attacked to them, called as what? AIDS. So that's why they are taking steps in controlling of drugs. Okay, controlling of drug abuse. Okay, controlling of drug abuse, and also advocating the people about safe sex and promoting regular checkups for HIV. Okay, regular checkups for HIV. Now they are giving the prior information about how to maintain safe sex means what? Should not maintain multiple sex partners, and they should go for regular checkups for HIV, especially in the populations where this disease is being spread. They are asking for going for regular checkups. Okay, regular checkups are very important. And please remember, as we said, that this disease causing virus is present mainly or spread through the fluids. Okay, we said that it is spreading through the fluids. Okay, it is spreading through the fluids. This is also an important point. Okay, we should keep in mind. And why it is important? Why it is important? So I said here fluids. It is important. Why? Because fluids means, okay, you may be thinking that it is only through the blood. Yes, of course, it is only through the blood. Okay, but please remember, this disease causing microbe or HIV virus is also present not only in the blood, it is also present in the tears. Okay, it is present in the tears, it is also present in the saliva, it is also present in the breast milk. Okay, it is also present in the breast milk of mother, and it is also present in the urine. Okay, it is also present in the urine. Okay, all these we have to keep in mind. So let us keep in mind all these. Okay, urine. Urine means what? Urine secretions. Okay, urine secretions. Okay, where in that part, okay, of the excretory system it may be residing. Okay, it may be residing, and in the females it may be there even in the vaginal secretions. Okay, vaginal secretion. This is present, but the thing is, it is been identified that it is not spread through these. Okay, it is not spread through these, but it is present. It is present, but it is only spread through what? The blood. Okay, it is only spread through the blood, we say. So here, this is all the complete information which we should keep in mind when we are talking about the disease called as AIDS. Okay, when we are calling the disease called as AIDS, and we should remember that this, when we know that this disease called as AIDS, okay, is not spreading through the physical contact or touch, we should not try to isolate those people as we isolate the people who are suffering with the disease, okay, suffering with the disease such as COVID or other diseases, okay, pneumonia and all. Okay, those people who are suffering with pneumonia, we will try, pneumonia or typhoid, we will try to isolate them. Okay, pneumonia or typhoid, we will try to isolate them. But those people who are suffering with AIDS should not be isolated in the society, but we should give them moral support. We should give them moral support and protect them and encourage them that they will not lose their confidence. Okay, because it is not a disease which is spread only through what? This sexual contact. There are also small children who are suffering with AIDS, but it doesn't mean that they practice the multiple sexual partners. Why? Because we said here that this disease may also spread through what? From mother to the child. And when the child is not identified that the child is suffering with the disease, there are chances that the child starts growing, and then later on the child may be identified that he is suffering with AIDS. So that's why we should not misunderstand those people who are suffering with AIDS, okay, are suffering only because of what? Sexual contact. Okay, we should keep that in mind. And moreover, let us remember that the December 1st, okay, December 1st, okay, December 1st is being, okay, recognized as the World AIDS Day. Okay, it is being recognized as AIDS Day. Okay, AIDS Day. Please remember, it is being observed or recognized as AIDS Day. Please remember, December 1st is observed or recognized as AIDS Day, which means on that day they take more initiativeness to identify those people who are suffering with AIDS and protect them, and also counsel the others, youth or everybody, how this disease is spreading, and protect to take necessary measures to protect themselves from this particular disease. Okay, they bring a lot of information about this particular disease and how to prevent this disease. They will be giving more information. So these are all the points which we should keep in mind when we are talking about the disease called as AIDS. Okay, called as AIDS. So another very interesting point, okay, another very interesting point and a very important point we should keep in mind when we are talking about AIDS. Already we discussed that the cells which are being attacked by HIV virus in our body are macrophages, we said. Okay, macrophages we came across, and we also said T helper cells, are also being attacked, and also B cells are also attacked by this HIV virus, we say. You may get a doubt now, why is it that this HIV virus is targeting these cells? Okay, is targeting these cells. It's all because these cells, please remember, it's all because these cells are having a glycoprotein on the surface. Okay, they are having one glycoprotein called as, in short we call it as CD4. Okay, CD4 we are calling it as. Please remember, this is very important. Okay, very important. Why the HIV virus is attacking these cells? Macrophages, T helper cells, B cells, dendritic cells. Okay, why these cells? Okay, also another one we can call it as dendritic cells. All these are immune cells we call. Okay, why these cells are being attacked by the HIV virus? Because they have a glycoprotein called as CD4, cluster of differentiation. Cluster of differentiation. Okay, a glycoprotein called as cluster of differentiation. It is this glycoprotein which is being recognized or identified, okay, by the HIV virus, or otherwise we can call it as, it is a receptor. It is a receptor which is being identified by the HIV virus, and it will try to destroy. Okay, it will try to destroy. So this is very important. Please remember, CD4 cells we call them as CD4 cells, which are working as the receptors on the surface of this, which are recognized by the HIV virus. Okay, thank you.